We're at item number 8, AB 1739, Medi-Cal. And we have support on both sides, so we can,
I'll move the one that's for the motion.
keep it brief.
Thank you, Chairman and committee. I'm here to present AB 1739, Medi-Cal allergy testing. I would like to note that I will be taking the clarifying committee amendments listed in the analysis, and they were worked on with the committee and the sponsors, and I appreciate that work effort. I just want to start off with an interesting thing. Last night, I spent the whole night up until about 3:30 in the emergency room at Sutter Medical. I'm keeping this on in case it happens. I had a severe allergic reaction, something I had never had before. I don't even know what it was to. So they gave me a handout and what to look for, and they're going to be doing a blood test so that we can determine what it was, because there is no indication in all of my life. I never had anything. So I thought how appropriate this is.
Maybe you're allergic to the legislature.
It could be at this point.
A lot of people do.
Historically, allergies were diagnosed by allergy specialists who use the skin prick test to infect the skin of the patient for what some of the items they feel they might be allergic to. And the patient has to be referred to an allergist and do these series of sometimes multiple tests. Blood tests are equally effective in diagnosing allergies and can be ordered directly by a primary care physician without referring to a specialist. Private pay health plans, Anthem, Kaiser, Aetna, recognize the equity of blood and skin testing and do not favor one over the other. Medi-Cal, however, does not. And I'll just kind of skim through here. I have with me Dr. Leibel and Dr. Lee Haber, both board-certified allergists, here as witnesses, and I would ask for your support.
Chairman, committee, thanks for having us. My name is Sid Leibel. I'm an assistant professor at the University of California, San Diego, and practicing allergist at Rady Children's Hospital. In that position, I train fellows and residents. I also have just completed a master's of public health, and so my interests are in underserved populations and increasing healthcare access. So I've had a chance to review the DHCS opposition to this bill, and it's my conclusion that that the department actually has things quite backwards. It's the actual existing policy that's in conflict with our academy's recommendations as far as skin tests and blood tests. Our academy actually is actually in line with the bill that is being proposed. My understanding is the department is under the impression that there's new allergy testing guidelines that are coming out. I'm not aware of that being the case. By voting aye on this bill, I think it would modernize the way that we're doing testing for allergies, bring us up to speed with where things are at from a medical standpoint, and with open access to our Medi-Cal fee-for-service population. Thank you.
Thank you. Anyone else in support?
Greetings. I'm Myron Liebhaber. I'm a board-certified allergist at Sansom Clinic in Santa Barbara. I'm also an associate professor on the teaching faculty at UCLA. I am here to support approval of AB 1739. The current policy basically just does not keep track with what's happening scientifically. I did want to just mention one thing, and that's access to care. About 20% of the population has significant allergies, and access to care, especially for Medi-Cal patients, often limited. There are no more than 500 allergists in the state of California. That number is dwindling, by the way. They were responsible in 2015 for doing about 1,000 skin tests. And so access to care is limited to those physicians, oftentimes resulting in a 4-month wait for referral to an allergist. So primary care physicians who don't do allergy skin testing can do an equivalent test, which is the allergy blood testing, and that test is on a par with skin testing. So it gives primary care physicians a tool to work with in terms of diagnosing allergy and treating allergy patients. In my own group at Sansom Clinic, for years I've been the only allergist in a 200-man group. We take CenCal, we take Medi-Cal, we're a nonprofit foundation, and I couldn't possibly provide the allergy care. So I asked my referral physicians to do the blood test, try to deal with the allergies as best they can, and most of them could, because the answer was pretty simple and straightforward. This resulted in savings to our system in terms of cost and better quality care. As a practitioner, I recommend approval by the Senate Health Committee of AB 1739 to improve access to care, quality care, and ultimately reduce costs.
Thank you. It's been approved, it's been supported on both sides.
Mike Robeson on behalf of the sponsor, Thermo Fisher Scientific, in support. Thanks.
Thank you. One other support?
Greg Herr on behalf of the California Life Sciences Association in support.
Opposition? Questions, comments? Seeing no questions or comments, we have a motion. Would you like to close?
Thank you, Mr. Chairman. I urge an aye vote for this important and now personal issue.
Thank you. Chair is recommending aye. It's item number 8, do pass as amended appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Nielsen. Pan. Roth. Roth, aye. Wolk.
Currently has 3. We'll place that bill on call. We're going to go to item number 6, AB 1300, Ridley Thomas, Mental Health and Voluntary Commitment.
Do you want to see it going in?
Yeah. Do you?
Dina, do you have vote cards for these cases?
Assembly Member El Toro.
Indeed. Bien, gracias, señor.